All right, I'm going to get us started. Hello, everyone. My name is Jordan Hines, and I'm the Program Director for the Children and Families team here at the National Governors Association Center for Best Practices. The NGA Center is proud to welcome you to the 2021 Child and Family Wellbeing Governors Summit. This convening is the culmination of a learning community organized by NGA and generously sponsored by Casey Family Programs. Over the course of the past 9 months, the Child and Family Wellbeing Learning Cohort has fostered a collaborative peer-to-peer learning environment for states to learn together, share best practices, and advance initiatives that promote child and family well-being in their states. Gathering monthly, this learning cohort has convened a network of peers from across and within the states, including from Arkansas, Connecticut, Delaware, Hawaii, Iowa, Kansas, New York, Virginia, and West Virginia. Today, you'll hear from 6 of these states about strategic initiatives they've developed as part of this network through technical assistance with NGA and Casey Family Programs. Following these presentations, we're thrilled to host a panel of governor's advisors, which will impart wisdom and insights into governor's priorities in this important field. And now a quick word on webinar logistics. If you would like to ask a question of the panelists during the panelist section or of the state presentations, please submit it in either the Q&A box or the chat box at the bottom of your screen. We will try and answer it in real time, and we'll send out a follow-up email with responses as well as contact information for state and relevant resources. So now I am happy to present some remarks from David Sanders, the Executive Vice President of Casey Family Programs, who has generously supported this learning network as a partner and supporter of NGA's Children and Families team.
Hello, I'm David Sanders, and I'm a Vice President at Casey Family Programs. And I would like to thank the National Governors Association and the 6 states who are participating for your leadership in caring for your most vulnerable citizens. You've done that through your involvement in the Child and Family Wellbeing Learning Cohort. The most important job of government is protection of its citizens. And the most vulnerable of those citizens are children who are abused or neglected. What's most important is to get to them before they are abused or neglected. Too often, as a system, we respond after children have been harmed and are able to provide treatment, but the devastating impact of abuse or neglect has already occurred. Those of you participating in the cohort are saying that you are committed to creating conditions in your state that assure that many fewer children ever experience abuse or neglect. I believe all of you in attendance have made that commitment. Connecticut, Delaware, Hawaii, Kansas, Virginia, and West Virginia have all chosen issues that suggest that you are well informed and serious about improving the condition of children in your state. It's clearly tough work, but with your attention and continued prioritization of these issues, I believe that you'll produce positive results. It's important for me to reiterate that at Casey Family Programs, we're committed to ongoing support for all of the states that are engaged in efforts to improve conditions of the children and families in your state and in your communities. And I'd like to assure that will continue that commitment after this cohort. In addition, I do want to, again, thank National Governors Association for their long-standing partnership with us and their commitment to leadership in assuring that government is able to carry out its full responsibility. So thank you, and have a successful meeting.
And I would also now like to introduce Ryan Martin, who is the Deputy Director for the NGA Center for Best Practices, where he leads the center's policy work to help develop innovative state solutions. Turning over to you, Ryan.
Thanks, Jordan. Great to be with you all. It's great to see a short note there from David Sanders. I've known him for a decade. Great person and a great partner to NGA as well in supporting the work that we do with states. Really glad that we can have so many folks joining us today. Looking forward to coming months and years when we'll be able to get together in person again and have these kinds of discussions, which will be great. I just wanted to give folks a real high-level overview of NGA and the Center for Best Practices, and just really congratulate the states that have participated so far and talk about some of the things that we can do to help other states as well. So the NGA Center for Best Practices consists of 12 different policy teams. And if you look at our website and you go to the staff list, you can see under program director, you'll see Jordan listed there as the program director over children and families, and then the other 11 as well, covering a variety of areas, everything from energy, infrastructure, broadband, healthcare, public safety. And so it's really great to work with states and to help them move their policy goals forward. Each team is fairly small but mighty, as few as 2 and as many as 5 or 6 staff. And our role, there's a few main roles that we fill as NGA. One is as a convener. I'm sure many of you have seen, obviously, through this webinar and in-person meetings that we're all about getting people together to share ideas, pros, cons, things they've learned, trials they've been through, challenges they faced. And so we're glad that we can do that again today. We're also facilitators, helping exchange information. We get lots of requests where a state may be in a certain situation and they say, we're trying to figure out this certain issue. Can you help us out? And so our role isn't necessarily to always be the expert and know the information, but it's about knowing the experts and how to find the states and others who can help you achieve your goals. The other is a great visualization a former colleague mentioned to me is calling NGA as a personal trainer. So this is the kind of, what do you want to look like next summer when you go on vacation? It's this idea that we work with states to help them distill their goals and their plans and to come up with actionable policy information so that they can not just think about policy, but actually apply it in the state. The states that have participated in this cohort for the last 6 months have really focused on improving service delivery and better coordinating with other systems. And that's a really key role that NGA can help play. There's lots of organizations that work in specific health issues or children's issues or education issues, but our key role at the National Governors Association is that we can help states link work across silos. Governors are able to direct the focus of multiple agencies and even non-governmental entities to really coordinate in a way that individuals in the state or other organizations may not be able to. So really grateful to Jordan and her team who've done a great job in working with states and providing you the information you need. And I'll turn it back over to Jordan.
Thank you so much, Ryan. I am now so excited to present to you the 2021 Child and Family Wellbeing State presentations. These presentations are recorded, but we encourage folks to engage in the chat and connect with peers in real time during presentations. Unfortunately, we are running on a tight timeline, and in order to fit everything in, we don't have the capabilities for a live verbal Q&A, but if you have questions about a state's presentation or landscape, please drop it in the chat. And a state team's representative can answer in real time, and NGA will certainly also coordinate responses and follow up on any questions following the summit. And with that, we can kick off the presentations.
Hello, I'm Stacy Tweedy, Southwest Regional Director for the Kansas Department for Children and Families. It's an honor to be with you and share information about how Kansas is transitioning from a traditional child welfare system to a child and family well-being system. When the COVID-19 pandemic began and schools began to shut down in the spring of 2020, a national conversation inspired us to work with several partners to create a Kansas Surge Protection Work Group to explore communication to educators about supporting families. Later in the summer of 2020, Kansas participated in Casey Family Program's 100 Days of Learning cohort and began the National Governors Association Learning Group for front-end service transformation. From those conversations sprang the Community Supporting Families pilot program we're presenting today. Community Supporting Families is a multi-agency collaboration with the Kansas Department of Education, Unified School District 253, and the Kansas Children's Service League. As we kicked off this effort, a few things stood as core beliefs for our partnership. Communities and families are their own experts. Communities possess meaningful resources, and we should be providing the earliest support possible to families. If we want to switch to a child and family well-being system, we must start thinking of educators as mandated supporters, not mandated reporters. And the goal to prevent the need for formal child welfare contact. Given these beliefs, we set out to determine how we could connect families to services without a formal DCF intake. In order to make this happen, the pilot set 2 goals, one short-term and one long-term. In the short term, how could we build competencies and capacities within the Emporia School District to connect families to community partners where there is a need for services that doesn't include concerns of abuse or neglect. Longer term, to expand this effort to other communities and school districts and continue shifting from reporters to referrers and supporters. Our world has been kind of topsy-turvy the last couple of years, and whenever those uncertain times come, that provides more stress for individuals, and of course that provides more stress for families. And so more resources, more supports have been needed.
At the beginning of this pilot program, there was a lot more risk factors in place for kiddos, for families, because of that heightened stress, that lack of resources in place.
Teachers became much more firsthand observers about what was happening in homes, and the reality was in their face. And then I think they felt very helpless at times about what they should be doing or what they could be doing.
It's hard to shake that negative impression that they might have had of us beforehand. And there's this innate fear always if DCF shows up at your door.
Helping parents feel more safe and normalized for reaching out and looking for resources is probably the biggest challenge.
Learning the different politics in everybody's organization, and the different processes, the different legal aspects that we had to think about. When you do have a larger district, a larger organization, it just takes longer to affect change.
We will have to help the community to understand the shift in the dynamics of DCF and other social service agencies, that we're there to support, that we're not automatically there to find fault or to be negative or disparaging to them. We really want to support them, and so being a resource for them in their time of need rather than being somebody who's going to come in and find fault with them.
Emporia size has been great because it's not too big, it's not too small, but there's also resources that people who have passion have started those resources, or organizations that we don't necessarily know. But there might be larger organizations like Kansas Children's Service League that might know of various organizations. So just having more of those conversations and more intentionally has helped us. And so it's just helped, I think, the district, we've just developed tighter relationships.
This is all about prevention and early intervention, making sure that we get into families early, before the crisis, before the children experience adverse childhood experiences, before they realize trauma or crisis. It's much healthier on our community, but overall it's the healthiest for our children.
Early successes is that we do see families getting those resources faster than they're able to maybe before, and through that 1-800-CHILDREN, making that much more accessible has been a big success. And I would say just a strengthened relationship with those agencies and those organizations, that we have a much better understanding of how the organizations are working. Plus, we've been able to help DCF promote what they're doing as far as a supporter and then the not reporter.
We've certainly seen a lot of success, and the family doesn't feel attacked. They feel supported. We can make creative plans to keep them safe, to keep the kiddos safe. We know that they're more successful willingly doing it, and taking out us as like a middleman to get you there. I think that'll be really important, and I think we'll see that very quickly as soon as we get it like fully on the ground.
Thank you to our partners for their commitment to this effort and for sharing their wisdom with us. So where do we stand? We established 6 success indicators. We are still waiting on data on 2 of those indicators: reducing the number and percent of families in need of assessment reports of school-age children, and reducing the number and percent of physical neglect or lack of supervision types on school-age children. Our other 4 indicators we achieved during the pilot program. Those are cultivating champions in the Emporia School District, improved communication between educators and DCF, establishing a clear path to replicate the program in other areas, and exploring the intersection with this pilot and efforts to establish a family resource center across Kansas. Thank you again for allowing us this time to present our Community Supporting Families pilot program. A special thanks to the Kansas Department of Education, Unified School District 253 Emporia, and Kansas Children's Service League. We appreciate your partnership. Finally, a special thanks to our DCF leadership, Deputy Secretary Tanya Keys and Secretary Laura Howard. Thank you for your support and your guidance. Thank you.
The Connecticut Department of Children and Families Governor's Summit NGA presentation. Hi, my name is Tracy Davis. I'm the Director for the Connecticut Department of Children and Families Academy for Workforce Development. It brings me great honor to be able to introduce to you our Connecticut team. We have Jeanette Blackwell, Assistant Chief for Regions 1 and 5, Natalia Liriano, Director for our Foster Care Division, Vincent Russo, Legislative Program Director, Zoe Stout, Assistant Legal Director, and our partner from the Governor's Office is Chloe Cummings, Senior Associate for the Legislative Affairs. As we reflect upon our experience in the cohort, it was clear to us that we often work independently in our different silos, but this experience has allowed us to come together on a more professional level and focus on common goals and objectives that will allow us to better serve our children in care. As a group, we decided upon the following goals: improve permanency outcomes for children in care, close the virtual gap for children and families, and enhance workforce development opportunities for our staff. Our first project linked to our goal of improving permanency rates was the inclusion of the Rapid Permanency Review. This is a model designed by Annie E. Casey aimed at improving timely permanence for children. The model focuses on identifying system barriers, both internal and external, while working with executive-level partners to mitigate those barriers. It also identifies best practice that can be replicated throughout the state. It's a point-in-time review of a specific cohort lasting no more than 30 minutes. In Connecticut, the cohort consisted of children in care 2 years or more whose parents' rights were terminated, with a plan of adoption and in a family setting. From January 2021 to March of 2021, the first cohort consisted of 68 children. 68% achieved permanency through adoption, 5% had a change in plan, and 26% have not yet reached permanency. One success that we're very proud of is our ability to roll this out statewide, and our winter cohort will consist of 126 children to be reviewed. Barriers to consider and overcome would be the subsidy process and access to Social Security numbers and birth certificates. The second project, focusing on improving permanency rates, had to do with a collaboration between the Connecticut Department of Children and Families and the judicial branch. The Waterbury Superior Court for Juvenile Matters was selected due to the volume and length of time between terminating parental rights and permanency disposition. The collaboration, called the Transformation Zone, brings together leaders from the Waterbury Department of Children and Families, the Superior Court for Juvenile Matters, Division of Delinquency and Child Protection, the Division of Public Defender Services, and the Assistant Attorney General. The group exchanges and shares information, provides training, assesses gaps, and finds solutions. In order to assess the court-related delays, it established a rapid legal review of a cohort of 86 children with a permanency goal of termination of parental rights or reunification. The reviews were led by the Department of Children and Families Assistant Legal Directors. The findings of the review led to the court making changes to its docket in order to expedite permanency. Of the 86 children, 67 achieved timely permanency. The initiative experienced setbacks due to the pandemic and the court closures. However, it's back on track in Waterbury and now is being implemented in a second transformation zone with the Bridgeport Department of Children and Families and the Bridgeport Superior Court for Juvenile Matters. Our second goal centered around the improvement of the virtual achievement gap. A positive development from the pandemic has been our effective use of virtual communication, particularly with children committed to the department. Once it was clear that access to services would be difficult due to social distancing, the governor signed an executive order which the legislature eventually passed into law, permitting several medical and behavioral health services to be administered via telehealth. This permitted our providers to perform therapy with children and their families over the phone or using video conferencing systems. If a family needed equipment or Wi-Fi in order to connect with a provider or school, DCF was able to use grant dollars through the Chafee program to purchase computers and internet service. Once in place, DCF took advantage of this opportunity to provide cell phones and Chromebooks to our adolescent population. In doing so, adolescents were able to virtually visit their parents more often and took a more active role in their case planning by attending their administrative case reviews. DCF had been trying to increase the youth participation in case planning for years, and conducting the case reviews virtually achieved that unintended benefit. Our third goal focused on enhancing workforce development opportunities for our staff. The Connecticut Department of Children and Families is in the midst of preparing for a large exodus of staff due to retirements in 2022. To ensure that the remaining staff are prepared for lateral and upward mobility opportunities, the Academy for Workforce Development has outlined several professional development opportunities for staff to partake in. Mock interviews have been made available upon request to enhance staff's ability to interview and to receive immediate feedback. In-service courses are available that provide staff with information relevant to preparing for supervisory or managerial roles. More emphasis has been placed on focusing on the employment of interns and the recruitment of Spanish-speaking students. And a stronger focus has been placed on strengthening the partnerships with area universities and colleges to enhance the pipeline to the department. The work we have done and continue to build upon would not be possible without strong partnerships with other state and federal stakeholders. We have partnered closely with the Judicial Branch, the Office of the Attorney General, and the Office of the Public Defenders on strategies regarding improving permanency. The State Department of Education, local schools, colleges, and universities, and the network of children's behavioral health providers have been instrumental in our work to close the achievement gap and to assist in developing that pipeline from the universities and colleges to the department. Each of our initiatives have benefited greatly from our strong collaboration with Casey Family Programs and Annie E. Casey. Our involvement in the intensive technical assistance portion through NGA afforded us the opportunity to think creatively and strategically about our goals and desired outcomes. The monthly meetings with the additional states created a venue for sharing ideas and definitely increased our awareness and knowledge base. We wish to thank the National Governors Association for providing intensive technical assistance and support. We also thank our colleagues from other states for their peer mentorship and sharing their bold initiatives. We are deeply grateful to Governor Lamont for providing our agency with this wonderful opportunity for national cross-collaboration to make meaningful progress on behalf of children and families in Connecticut. Lastly, and certainly not least, we thank Commissioner Durantes and the rest of the DCF executive team for selecting this cohort to lead our agency in mission-driven work that improves outcomes for the families we serve.
Hello, and thank you for the opportunity to participate in this NGA Virtual Governors Summit on promoting child and family well-being. My name is Kristen Zagar, and I'm the Deputy Commissioner of Human Services at the Virginia Department of Social Services. The Human Service portfolio consists of our Family Services Division, which oversees CPS, in-home, foster care, adoption, and 4B and 4E programs, as well as our Benefits Division, which oversees TANF, SNAP, Utilities, Employment, and Medicaid. At VDSS, the Human Service portfolio is well positioned to look at the families served by both of these divisions, which is one of the reasons we're excited about this NGA opportunity. As we began to look at our data, we realized that we're receiving a lot of CPS neglect-focused referrals that were connected to poverty-related items, and we began to wonder if there were a way to shift our system to meet the needs of families prior to involvement with the child welfare system. We realized that what started as a project in the Division of Family Services, looking specifically at CPS referrals, really grew into thinking differently about how to align our department infrastructure to work more seamlessly between divisions. This internal alignment of workforce, funding, policy, and data could prevent the need for some families to be served by CPS as a first response. It would right-size our CPS and foster care workforce while serving families in a whole family approach. We're calling this crossing the aisles. This vision is supported by the research and presented several sessions ago by Claire Anderson from Chapin Hall, where they looked at the impacts of increasing or decreasing economic supports on child abuse and neglect. We really envision this infrastructure alignment as an evolution of our social service system that will take place over the next several years. But before we talk more about the evolution, let's review some of the data that got us thinking about this project. As we look at our hotline data in Virginia, in 2021, we received 78,775 referrals, and of those, we accepted or validated 43%. Of those accepted referrals, 73% resulted in a family assessment and 28% in investigations. Since we do not consider poverty alone as neglect, to better understand the impact of poverty on the families we serve, we needed to identify a way to directly correlate poverty to families being served in our system. So we looked at the 10 categories of physical neglect most closely related to instances of poverty. Some of those categories are inadequate supervision, inadequate shelter, inadequate food, inadequate personal hygiene, and inadequate medical care or treatment. On this slide, we can see that of the 43% or 33,800 referrals that were accepted, and of those, the 13,866 have poverty-adjacent neglect items. And of those, about 44% also had documented parental substance use. So as we can see, about a third of our referrals involve poverty-adjacent neglect. So let's take a closer look at this. On this slide, about 77% of the poverty-adjacent neglect referrals that I just discussed on the last slide are for inadequate supervision, followed by 15% inadequate housing, followed by inadequate food, inadequate hygiene, and inadequate medical care or treatment. With this information, we began asking ourselves, what would it look like if these families could receive child care subsidies, housing, benefits, and food and medical benefits prior to becoming involved in the CPS report for neglect. This led us to the NGA crossing the aisles and to our evolution. The evolution is how we're describing our system infrastructure alignment to better serve families further upstream by primary prevention programs and through concrete supports via our benefits programs. We believe that this focus will increase prevention by serving families with poverty-adjacent neglect prior to CPS and decrease the use of foster care, specifically congregate care. We believe that this will happen by moving from a CPS hotline to a helpline so we can serve families further upstream by aligning our internal infrastructure and external partnerships with primary prevention supports and housing partners, which will better position us to provide concrete supports to meet the basic needs of families such as food, childcare, medical, and utilities prior to CPS involvement. In Virginia, we're utilizing our current initiatives to support this evolution, which include a coordinated primary prevention response through our Thriving Families initiative, in combination with Crossing the Aisles, which is our NGA initiative of aligning our infrastructure, and focusing on Kin First culture, which is aligned with our Families First and in-home supports, while prioritizing providing concrete supports and using a whole family approach through our benefits programs and our prevention partners. So we've created a timeline to help lay out the full evolution. Due to our involvement with the NGA, we've begun this process and have met our established milestones where we've started our awareness campaign to include working with our 120 local department directors who are supportive of this evolution. We have submitted the need for legislation and budget requests for the upcoming 2022 General Assembly session, and we've identified funds to support data alignments and plan to move into strategic planning next year. We're working with our stakeholders and partners and look forward to beginning the implementation process in 2022 with holding a 3-branch event. We know that large-scale system change takes a while, and we hope to see implementation within the next 5 years with spread and sustainability in all 120 local departments within the next 10 years. We do appreciate this opportunity and the support from the NGA, and we look forward to the evolution. Thank you.
We started this project probably about a year ago through technical assistance through the National Governors Association. What we recognized was there was an opportunity to make some pretty significant changes relative to the impacts of the pandemic that children and families were experiencing. One of the things I think that we recognized is that several things were happening as we went through that process. With the shift to a virtual learning platform, a couple of things happened. So the first thing, students weren't in classrooms. So with students not being in classrooms, that limited the ability of educators to be able to identify signs of abuse and neglect and provide that level of support that was needed. What was also happening during that time is that families were struggling to access resources for their children and for their own families. So our goal was to enhance both sides of that, to help educators realize how they can identify signs of abuse and neglect in a virtual platform, and then to help families realize what is available to help them with the myriad of problems that were created through the pandemic. Some of those problems, they existed before the pandemic. Food insecurity, housing issues, struggles around getting mental health services for students. But the pandemic really elevated those concerns. So we wanted to find a way to strengthen the health and well-being of families while ensuring that children were safe.
Through that, we came up with an idea around creating a resource application for students. From the premise that if students weren't able, and families weren't able to come into school and talk to their guidance counselors or their teachers who normally give them those supports, that we could put it in their hands, right? We know that every kid generally has a phone or some sort of device, particularly in the pandemic, because schools were providing that for them. So if we could make those resources and tools available on those devices, that would increase the amount of supports that students and children were able to receive. We know if you're a 12-year-old student or a 10-year-old student and there are challenges happening in your home, You don't know who to talk to if you don't have a teacher or a trusted adult that you can go and speak to. I myself am a former middle school teacher, and so I know particularly at that age, if you're not talking to kids and developing those relationships, they're not gonna freely tell you that kind of information. And so, but they might look on an app and say, like, I wonder what happens if I text this number, or I wonder what happens if here's this resource about food and I see that my fridge is empty more often than it used to be. So maybe I should show this resource to my parent and see if it can help.
So as we worked through the project, we had to be flexible in where we started and where we ended up. And pivoting was key for us. So sometimes an idea of where we started and where we ended were a little bit different, but that really led us down into figuring out what was best for what's going to be best for our communities. We figured out it was best to create a resource hub linking all the resources that we have throughout the state for families to access at just one click of the button. So, like I said, what we found over time is there's so many great things out there. We just needed to give a centralized place for that. Throughout the process, it was great to have the support of the NGA work group and the leaders to, get us back on track if we thought we were veering off in a certain direction. It was super helpful to have, those resources and the groups to hear what some of the things that they are doing in their states to help us guide our work.
Lessons learned with all the collaborators on the National Governors Alliance, which comprised of really the multidisciplinary team that responds to the needs of children and the needs of educators, was first of all, how dynamic educators and school employees abroad, school counselors, school psychologists, paras, and the school nurses, as well as teachers, how they literally had to flip a switch within a day or two and continue with the education of our children. So for that, we are most grateful. What we learned was that the rest of us who serve on the multidisciplinary teams was that we could do a better job in providing them with the supports they need to protect the safety and well-being of children, with a particular focus on abuse prevention. We believe at the Bo Biden Foundation that abuse of children, as well as bullying and neglect, is something that can be very preventable if we provide them with the tools on how to recognize, respond, and report to it. And even beyond that, to move towards primary prevention strategies to prevent children from being in those situations in the first place. So we spend the large majority of our time training, policy writing in collaboration with folks who serve children and their families to establish a response for suspicions of abuse or neglect, also to provide student programming for bullying and cyberbullying, and then also to help them have the resources to provide families with in these situations.
I think the best part of the collaborative effort was being able to have a seat at the table from an instructional technology perspective. Having students learn remotely was a challenge over the past 18 months, and trying to get kids to install an app or to have access to a tool, it presented its challenges. So what we thought of from our perspective, and having that perspective of working with kids in that digital environment, was to try to find things that already existed and build a bridge to them from their digital school environment. So typically with any sort of issues that would arise that a student might be experiencing potential for domestic abuse or an unsafe home environment or relationship issues, they would have their teachers to go to, but they might not have had that access due to a myriad of reasons through the pandemic. So by putting the access and that bridge to those resources in their digital school environment through their learning management system, for us was a way to ensure that all students would have access to those, and they wouldn't have to have access to an additional device or an additional connection or an additional service.
West Virginia, strengthening child welfare practices statewide. The state of West Virginia is re-envisioning how it delivers child welfare services. The following presentation is an overview of the state's current goals and innovative practices and programs focused on improving the well-being of children and families. Currently, West Virginia's goals for strengthening the child welfare process are to prevent the unnecessary removal of children from their homes through high-quality prevention services and to improve and support family settings when placement is the only option. The Bureau for Social Services has collaborated with sister bureaus, the Court Improvement Board, Department of Education, child placing agencies, and many private providers to develop initiatives that serve families early and in their own communities. The Bureau for Social Services has had several noteworthy successes and accomplishments in its efforts to enhance its community-based prevention services and reduce unnecessary removals. With the passage of the Families First Act in 2018, the state quickly mobilized to take advantage of this opportunity. 3 evidence-based services were identified to include in its Family First Prevention Plan with a focus on expanding availability and educating staff on programs' benefits and effectiveness. These programs include Parents as Teachers, Healthy Families America, and Functional Family Therapy. The state's prevention plan was approved in the fall of 2020 and our work continues in education and outreach efforts to agency staff and stakeholders as well as expanding services statewide. The state has also engaged in collaborative efforts across agencies and bureaus both internally to DHHR and externally to achieve our identified goals. Collaborative efforts within DHHR have resulted in a streamlined process to access intensive community supports for children and families in need. Services include Children's Mobile Crisis Response, Positive Behavioral Support, Assertive Community Treatment, and High Fidelity Wraparound. The state is currently developing its education and outreach plan to ensure all of our partners and community members have a clear understanding of how to access these services and the many benefits to providing effective interventions to children in their homes whenever possible. Unfortunately, not every child can remain safely in their own home. To improve the experiences of children in care, the state has been working towards enhancing foster home settings and increasing the use of kinship relative care. When children require placement outside of the home, several factors contribute to positive outcomes. One of these factors is placement with a relative caregiver. Placement with kinship relative caregivers minimizes the trauma of removal, it improves behavioral and mental health outcomes, and preserves family culture and community connectedness. West Virginia prioritizes identifying kinship relative caregivers when the placement of a child becomes necessary. West Virginia emphasizes diligent search efforts both at removal and consistently throughout the life of the case. Search efforts are facilitated through staff interviews with children and families through Family Finding, a service provided by Mountain Health Promise in which a genogram is built of possible kinship relative connections. Once located, West Virginia operates a Kinship Navigator program to support these homes. When placed with a kinship or relative caregiver, a referral is made to our Kinship Navigator program. A program navigator immediately contacts the family and completes a needs assessment. The navigator then begins locating resources to support the placement. They may obtain financial resources, bedding, emergency food, and anything that is vital in the first few weeks of placement before other services may be available. This leads to stability in the home and reducing caregiver stress and tension. As a result of these efforts, more than half of West Virginia foster children are placed with kinship relative providers. In addition to Kinship Navigator program, West Virginia also has a community-based foster parent network. The purpose of the West Virginia Foster, Adoptive, and Kinship Network is to build a statewide network of foster, adoptive, and kinship families for advocacy and support. The network provides group and individual support to help families navigate difficult and challenging situations. It provides training and enhances reunification through building relationships between natural and foster families. These efforts help reduce trauma for children and stabilize placements to avoid disruptions. This peer support and training helps families feel heard and valued, get timely answers to their questions, and build community with others who have similar experiences. For many children, placement outside of the home also means enrollment into a new school. Every school change for a child has the potential to set them back academically by 6 months. Children transitioning schools need additional support to stay on track. The West Virginia Department of Education has developed 2 services to help children have a successful transition both into and out of foster care. Education Recovery Specialist and Transition Specialist collaborate with foster parents, caregivers, the child's caseworker, and local county boards of education and others to ensure foster children have no barriers to enrollment or obtaining the services they may need when transitioning in and out of foster care. The state has encountered barriers to meeting its goals. One barrier is consistent messaging about available services and supports across bureaus, stakeholders, and the community. Messaging about available services can be fragmented and incomplete. Another barrier is that, similar to communities all across the country, West Virginia is experiencing workforce issues which make bringing some services statewide difficult. Lastly, shifting the philosophical beliefs of our staff and stakeholders to emphasizing and prioritizing community-based supports and removal as a last resort is a barrier. As the state has worked to build and implement these services and programs, it has learned that written, strategic communication plans are paramount. Shifting philosophical beliefs requires consistent messaging and a commitment from all stakeholders to facilitating these changes. As West Virginia continues to strive towards meeting its goal, it will take the lessons learned forward to achieve success.
Aloha mai kako, mai Hawaii ai ni ihau a ka aina e aloha. Aloha everyone, my name is Ola, and I'm so excited to be here to share our journey with you all today. Before we begin, we humbly offer this land acknowledgement of Hawaii as an indigenous space whose original people are Kanaka Maoli. The aina from which we join you stretches from the mountaintops of Pu'uwai, Mani Ihau to the shores of Puna on Hawaii Island. We also acknowledge the various indigenous lands from which each of you joins us and the original people of those lands. Today, we gather the wisdom and inspiration from our kupuna to our keiki. We honor and acknowledge the sacrifices made by those on this journey of exploration. I'd like to start with a bit of information that'll provide some context and framing for our journey. Historically, Native Hawaiians thrived through the generations. Native Hawaiians today are descendants of Polynesian wayfinders who for thousands of years traversed vast oceans using sophisticated navigation systems, which eventually landed them in one of the most remote chain of islands in the world, Hawaii. Native Hawaiians lived for many years isolated from the rest of the world with a viable culture that met the needs of a thriving, industrious, and religious people. The word ohana is one example that shows the deep interconnected relationship Native Hawaiians have with the land and with each other. Oha means to sprout, or a sprout, or offshoots of the taro plant, which furnish the staple of life for Native Hawaiians. With the suffix na added, ohana literally means offshoots, or that which is composed of offshoots. This term then, as employed to signify the family, has precisely the meaning, the offshoots of a family stock. Kinship in Hawaii extends far beyond the immediate biological family. The terminology of kinship is thought of against the background of the whole community of kith and kin, including in-law and adoptive categories. In the 1,000 years that ensued, Native Hawaiian descendants of those migrations built a thriving, sophisticated culture and a complex subsistence economy based on values of trust, shared responsibilities, and communal participation. The ohana still exists as a vital factor in Hawaiian life. Most Hawaiians nowadays adhere in some degree to both the old Hawaiian system and the American way. Modified and adapted due to urbanism, education, economic life, individualism, and intermarriage with other races? Is it desirable that it be perpetuated as a social institution and force? If desirable, can it be perpetuated where it still prevails? And can it be revived where it has lapsed? We continue our efforts and commitment to diversity, ethnic understanding, and cultural awareness of all the families of Hawaii to be responsive and inclusive of the diverse needs of the community while honoring the values, practices, and principles of the host culture, Native Hawaiians. The Department of Human Services Director Kathy Betts, who is also the governor's designee for the project, shared some thoughts on the history of NGA support in Hawaii. In 2018, Hawaii received the Robert Wood Johnson Foundation Culture of Health Grant, focusing on cross-sector collaboration in early learning spaces. In 2020, Hawaii participated in the NGA Child and Family Wellbeing Learning Cohort 1 with Casey Family Programs. And in 2021, we were fortunate enough to participate in the second learning cohort and receive technical assistance, also with Casey Family Programs. These learning cohorts have been in alignment with the 2-Gen movement and Ohana Nui, which is our multi-generational and integrated approach to the delivery of human services, addressing the social determinants of health and fostering co-creation and partnerships with families and other state and community partners. The onset of COVID-19 required responsiveness from the government and community. We had to make many quick pivots to ensure staff and client safety and well-being. Reports of child abuse and neglect decreased during this time as many mandated reporters were not having regular interactions with children and families. These concerns led NGA and Casey Family Programs to develop these learning cohorts, which fostered cross-sector collaboration and communications, as well as connecting Hawaii with other states on best practices. The following 2 slides clearly shows the broad cross-agency collaboration representing both the public and private sectors. We were able to identify 2 main goals through this work. The first goal was to expand school and community-based family resource centers statewide. We continue to work on defining FRCs and building a shared understanding across agencies and organizations who serve children and families. We are utilizing the National Family Support Network self-assessment tool in the existing school-based FRCs and plan to require this of our network FRC members going forth. This, along with the Governor's Emergency Education Relief Grant we received this year to provide a program coordinator for our school-based FRCs, and the addition of a practicum student to assist our state steering committee, has increased our consistency of practice as well as our capacity. Our second goal was to engage families equitably in this work, sharing leadership and decision-making. We've had our first parent advisory committee training from the National Family Support Network in Hawaii last month and plan to have another in the spring. This training will enable and empower the FRC staff to build and maintain parent advisory boards. We are still working on how we will assess and evaluate the effectiveness of our work across both school and community-based FRCs. As a result of learning and sharing from other states, a logic model was developed. Our hope was that if FRCs become successful, we'd be able to change existing assumptions, to change social norms to one that supports parents and leads to positive parenting approaches. During the first NGA Child and Family Learning Cohort, we found out that the Department of Education, Windward District, Kailua Kalahau Complex was creating virtual family resource centers. The Department of Human Services brought together Blueprint for Change, which oversees the network of neighborhood places or community family resource centers, the Department of Education, and other Native Hawaiian and community-based organizations to form the Hawaii Steering Committee, which then led to the creation of the Hawaii Ohana Support Network. Within a year, Hawaii had become a member of the National Family Support Network, the second NGA learning cohort with technical assistance, and was awarded the Governor's Gear Grant. Eala, ealu, e kuilima. This Hawaiian proverb is a call to come together to tackle any given task and acts as our rallying cry to encourage the continuation of this work. We share this final message with you and send you off with an abundance of aloha and mahalo.
Looking back at this opportunity, of course the partners saw some immediate needs and timelines. But the gem for us is that the real goal is aspirational. That is of serving keiki, children, and ohana, their families, in ways that affect them positively for years to come. Then approaching the work from an empowerment and sustainability lens will help get us there together as we navigate any issues.
All right. So thank you so much to our presenting states for sharing your unique and innovative approaches to improving the lives of children and families. It's been such a pleasure to work with you and to help bring your vision to life. So we will now hear from state leaders and representatives from governor's offices on how gubernatorial administrations can prioritize children and families at the state level. This panel will be moderated by my colleague, Belle Cuneo, who is a policy analyst on the Children and Families team at NGA and who shepherded states' engagement within this learning cohort. Hand it over to you, Belle.
Thank you, Jordan, and thank you to all of our states that participated. I think these presentations were a really great example of some of the innovative projects and initiatives that have been implemented throughout the cohort to help strengthen communities and families. These states have done some really incredible work over the past 9 months and are leading our country with some really unique and innovative solutions to help strengthen and reimagine child welfare. Each state in the cohort has worked in collaboration with the support of their governor's office to evaluate areas for improvement. We're now going to enter into our time of panel discussion to hear how governors are prioritizing and promoting policies to strengthen children and families at the state level. We have a panel with a wealth of knowledge and loads of important information that they want to share with us today. And we're on a relatively tight time frame to keep on schedule with only 30 minutes. My goal is to shine a spotlight on each of our panelists to hear how their governor is supporting an issue that doesn't typically get much attention. And I'm going to ask each panelist 2 questions. I'm also going to try my best to reserve some time at the end of our panel for participants to ask questions. So please, throughout the presentation or throughout the panel, drop any questions in the chat. And if we don't get the chance to get to it, I will follow up after the session and give you guys responses. Today, we are joined by child welfare policy advisors and leaders who I would like to introduce to you. From Delaware, we're joined by Alona Berry. From Hawaii, Dakota Anderson. From Kansas, we are joined by Secretary Laura Howard. From Virginia, Chidima Jenkins. And from West Virginia, we are joined by Michelle Dean. Thank you to all of our panelists for joining us today. Let's go ahead and jump right into our first question. As many of you know, every family that you work with is going to endure its own specific challenges. And the topic of child and family well-being, as we have seen in these presentations, is really a 30,000-foot issue, causing us to evaluate a number of different factors, such as health, safety, stability, and overall strength of a community. I'm curious what some of the first issues are that your governor decided to tackle at the outset of their administration to help strengthen families, and what some of those results were. Chidi, I'm going to start with you. I know that you are wrapping up the end of Governor Northam's administration and probably in a time of much reflection over all of the work that he has done these past 4 years. And so I would like for you to start us off and tell us what are some of those reflections that he has worked on.
Thank you so much, Belle. Yes, it's so nice to be here with you all today. And as you mentioned, we are getting ready to hand off the baton to the Youngkin administration in just a few short weeks here in mid-January. So this is a great time to reflect on where we got started. So I kind of went through the archives and just reminded myself a little bit of some of the things we started off and really prioritized. For those who don't know, Governor Northam is a pediatric neurologist by training and practice. And so he was practicing just before he was inaugurated and elected as governor. His wife, the First Lady, is also an educator, longtime educator, and really knows how education, both of them do, and health come together. And I think it's very important that we highlight that because it really set the initial goals for this administration around health, but also academic, just general, educational success of students and children. But we couldn't do that without taking a 2-gen approach and a whole family approach to all of those efforts. And so we really prioritized maternal health to get us started early on, but also a lot of work around early childhood. And that was the First Lady's platform. So I'll give the quick 1-2 punch on maternal health. Some of the efforts that we really felt like we checked the box on some of them were as a result of a strategic plan that was written. We went on a listing tour of the state throughout the Commonwealth and heard from a lot of our private and public sector advocates and stakeholders. And what came of the report, the plan, and some more recent legislative changes and investments were certifying doulas as community-based partners and members of the medical team. We know that that is a great prevention method for ensuring healthy babies and healthy pregnant and parenting people. We also got Medicaid coverage for their services, and so that was a huge win in our opinion. We also got a postpartum Medicaid benefit for pregnant people, which extended their benefits from 60 days to a year postpartum, which was a huge win, as well as extending or eliminating the 40-quarter rule, which previously did not allow legal permanent residents to be able to be eligible for Medicaid coverage. I could go into everything that we did for early childhood, but I do want to be mindful of time, but just highlight that we were able to, since 2018, double our public pre-K funding to serve a record total of literally more than 25,000 3- and 4-year-olds. And we know that those early learning experiences in those vital first years for a young child prepare them for academic success over a lifetime. So I will go ahead and pass the baton there and let some of my colleagues in other states share a little bit about where they got started as well.
Thanks, Chidi. Dakota, I know that you're also coming up on a similar position, and your governor is really thinking about, throughout his administration, about the legacy that he wants to leave behind and how that's just such a crucial aspect of Hawaii, and want to know what some of those main legacy pieces are that you guys are thinking about as you come into this last year.
Yeah, a big legacy piece for Governor Ige is definitely Ohana Nui, as mentioned in our team's video. So Ohana Nui, or extended family, is our multi-generational or 2-gen cross-disciplinary approach to promoting child and family well-being between the Department of Human Services and the Department of Health. And rather than being a specific program, Ohana Nui is a framework for delivering those services that seeks to break the generational cycles of poverty by concurrently addressing health and human services needs for the entire family. It was started internally within the department in 2016, but was permanently established in statute through Act 82, which Governor signed in 2019, and has already had a significant impact on our child and family well-being landscape. As an example, in conjunction with multiple departments, the state legislature, and various private organizations, we've seen incredible outcomes from our Family Assessment Center one-stop shop, which provides wraparound services for homeless families with the goal to have families placed in supportive or permanent housing within 90 days. Ohana Nui was also a driving force behind the Department of Human Services shift to an integrated enterprise system. This investment in our IT infrastructure paid dividends during the pandemic and allowed the department to stay current on applications for benefits despite significantly increased caseloads. Thank you.
Great, thanks, Dakota. Michelle, I want to turn it over to you now. I think you have a really unique perspective here as being somebody who's seen through multiple different governor's administrations and been in agencies. So what are some of the pieces from your time of Governor Justice's work that you would really highlight that has strengthened children and families?
Sure. So Governor Justice came into office in 2017, and like governors before him and governors that will come after him, he really wanted to focus on improving the child protection system. He really felt that funding for the foster care system was the anchor for that change. And he's really championed funding increases for the system, excuse me, and supported legislation that provided many needed improvements. Early on, some of the legislation that he signed made important strides, such as increasing our foster care subsidies and increasing not only our child protection workforce, but also their salaries and wages to try to reduce some of the burden and burnout on our staff. He's also supported funding for the for the expansion of community-based programs really designed to prevent the foster care placements in the first place. But I think that what is probably most notable is that the support that he has really given us to continue and improve the programs that people like myself, who are the day in, day out child welfare career professionals, believe to be impactful, such as increasing the rates for our state paid kinship care. And this is for families who would otherwise be ineligible for foster care subsidy. And that helps to keep children with their families and preserve that community connectedness and culture. And not only continuing, but expanding our wraparound program even after our federal funding had expired for that program. I think he really saw these opportunities as investments into our state through investing into this service and the system that protects our most vulnerable children.
Awesome, thanks for sharing that. And Secretary Howard, I think that you also have the unique experience of being a leader of an agency and being able to execute your work and the initiatives that Governor Kelly has prioritized. What are some of those things that she has prioritized for you in your time serving as secretary?
Right, thank you. It's also an honor to be here. And I would just want to start out just by thanking NGA just for the chance to have been a part of this cohort, and Casey as well. It was just very, very timely in terms of our work and focus. You know, I have a great privilege in working for Governor Kelly, who brings a real heart for children and families to everything that she does. That's really been true throughout her time in the legislature and then as she came into the governor's office. So when I think about some of those first issues that the governor prioritized that intersect with our agency, you know, the first does relate to the child protection system, or what we really now want to speak about as the child and family well-being system. You know, when Governor Kelly came into office and I came into this role, we had a foster care system that was pretty overwhelmed. And very, very limited prevention services, very few tools in terms of frameworks for that system. So, you know, we've done a lot of internal work with regard to the foster care system itself, but I really wanted to highlight here the governor's priority on prevention. So the governor very quickly supported enhanced funding for Kansas to be one of the first states to adopt the Family First model. And we kind of we plunged right in. And we weren't sure what we were doing, but we plunged right in knowing that we really had very limited prevention options across the state. That's been incredibly successful in the ability to have more community-based partnerships for prevention services, a key factor to what's led to about a 10% reduction in kids entering care for 2 consecutive years. That's been really, really important. The governor has continued to support those prevention and community-based service dollars. I think another area where the governor's priorities have really shined throughout this pandemic has been some of the collaborative work that my agency has done with our Kansas Children's Cabinet and our Department of Health around early childhood support. So we have a kind of an all-in for Kansas Kids project where some really extensive strategic planning happened across the state about the early childhood system. That's really the governor's area of passion. We've had a lot of initiatives in that arena. We've been able to increase reimbursement rates for services, a number of quality initiatives, and some workforce initiatives that are happening right now. We're really excited about the opportunities there. And that early investment and focus on early childhood has really positioned us well to, I think, to make the most effective use of all of the federal child care dollars coming in. We just had finished kind of a 2-year process of kind of creating that strategic plan. So, I mean, I think those would be 2 things I would highlight here at the front end. The things everyone else talks about resonate as well in terms of some of the work we did, but that focus on community-based prevention supports and the focus in early childhood.
Thank you so much, Secretary Howard. Alana, I think your position kind of states how much of a priority that trauma-informed care is to Governor Carney, and your recent change of position to kind of prioritizing child well-being in a very specific way. So can you speak to some of the priorities that you are working and implementing for Governor Carney?
Sure, thank you so much for having me. I think the headline when talking about kind of the investments of Governor Carney across Delaware, it's really around a collaborative approach. So one of the first executive orders that Governor Carney signed when he came into office was around reinstating his Family Services Cabinet Council, which is really a body designed to bring multiple agencies together to collaborate and solve really challenging social issues, ones that we've all been talking about on this call today, is established to focus on things like workforce, violence in communities, substance use and treatment, reentry, housing, early childhood education, and the school to prison pipeline. And so all of the work in relationship to what the governor is focusing on is connected to the interagency body through the Family Services Cabinet Council. And that work really began the investment that the state has put into a trauma-informed approaches. And so about 3 years ago, the governor signed an executive order around trauma-informed care. And that work really started and has been the basis for the work of this group through the National Governors Association around child and family well-being. And so I'm really excited that we've had the opportunity to collaborate with one another. And I think you'll see from our video that we brought in both partners from community and state agencies and school districts to collaborate collectively towards creating an application for students. And that's just one example of how we've made this investment and collaboration across the state. There have been other projects around a dual generation center, which really put a social services agency within schools and districts across the state. And so here to really leave you all with this framing around collaboration has been the biggest investment from our governor here in Delaware.
Yeah, great. Thanks for sharing that. And I think an excellent point also of this entire cohort, all of these states just working so collaboratively with different departments and with governor's offices and local stakeholders. It's been cool to bring everyone together to help make progress and get things going. Now that we've been able to lay out the landscape a little bit and hear about your governor's achievements in this cohort and discussed what some of the barriers are that you guys have tackled to help support children and families, I want to know what are some of the things that are next on the horizon. Michelle, I'm going to kick it back to you. I know you were talking a lot about Governor Justice's priority of foster care, and what are some of the next things that he wants to tackle with that?
Sure. So we've been working over the past few years, really focused on expanding the availability of our community-based prevention programs and services preventing removal of children from their homes. And we have a lot of really great innovative programs. And of course, we want to expand these statewide, but even in the communities where they're available, they're underutilized in many situations. And so when we took a look at this, we realized that we didn't really have an effective communication plan to ensure that all of our agencies, across all agencies, all of our stakeholders, the community, our partners, even our own child welfare staff in some cases were aware of not only the availability, but the efficacy of these programs and why they're important to provide service, why it's important to provide services to children in their communities and in their homes whenever possible. So right now we're currently working to develop a written communication plan about serving children, especially with significant and serious emotional disturbances in their homes and communities whenever possible, and what services are available. And we're working collaboratively across our agencies and stakeholders to ensure that we're all speaking the same message and understanding what is available, who it's targeted to serve, and as like I said, as the efficacy of those programs.
Thanks, Michelle. Dakota, as we were discussing, you're focusing on these legacy pieces and coming up on a year of kind of closing things up. What are some of the biggest things that you are trying to get accomplished for Governor Ige?
Well, certainly we're continuing to work to create robust and seamless access to services across all of our agencies. We're very excited to move the proposal developed by the Hawaii team as part of this cohort, as part of the 2022 admin package. We think that codifying family resource centers in statute and creating a coordinator position will be a big step forward for fostering child and family well-being in the state. Additionally, through the NGA, we've partnered with the nonprofit Research Improving People's Lives to develop an online tool that will help connect job seekers with training and access to resources and benefits for their entire household. At the same time, we want to really be evidence-based in developing our programs and refining our programs. And so the Department of Human Services has partnered with the University of Hawaii for a SNAP longitudinal project to help us better understand the community's SNAP utilization, as well as food security and other nutritional issues that affect the unique populations of our state.
Great, excited to see some of those finishing pieces and things come together, especially with all of our collaborative work together on family resource centers. Some exciting stuff. Secretary Howard, what about you? What's next on the horizon for Governor Kelly?
You know, some of those things are things you've heard from other colleagues here on this call, but I think one of the most important pieces of work that we have launched right now with a partnership with our Kansas Children's Service League has to do with advancing the work of establishing a certified network of family resource centers. We think that's really, really critical work that we really wanted to make great strides on in the coming year. You know, another area has to do with our crisis services and behavioral health continuum. I lead the Children and Families Agency and the Asian and Disability Services Agency that has behavioral health. So we have a lot of cross-agency work going on. And while we were able to stand up mobile youth crisis program this year, we have more work to do to ensure that youth that have significant needs can be served in families in the community. So that's a critical focus. We also want to replicate the work that you heard about in the video in terms of community supporting families, our partnership with school districts. And then the last thing I would say is really gaining more allies in the philanthropic world. I'm working more closely with local governments. You know, we're a state administered human services system, but we think there are more opportunities to work more closely with our counties and cities towards common goals.
Yeah, that's great. I'm definitely hearing a lot of overlap in things, and I feel like you just offered to also be a support in helping with other states that are trying to put together family resource centers. So you piqued my interest there. Chidi, I'll now turn over to you. You are kind of having to think through a transition of administration and how to pass the baton to someone else and how to continue a lot of the momentum and the work that you've been doing and that Governor Northam has been doing. So what are some of those next steps? This looks a little bit different for you guys, but what are those next steps? How are you thinking about that?
Yeah, so luckily, I mean, I'll kick off by, well, actually, let me kick off by saying that we in Virginia really admire Delaware's work around trauma-informed care. For those who don't know, my title is actually Advisor on Childhood Trauma and Resiliency, and it's a specialized role in the governor's office that really works across our different secretariats on the issues of trauma-informed care and resiliency for children and families. But it's housed in HHR, which is why I get to be with you all today. All that being said, you know, I think as we think about the transition that's coming, the reality is that when we look back 4 years ago, the Northam administration, even before I was brought on, didn't campaign on promises. They really campaigned on values, right? And so for the past 4 years, we acted on a lot of those values that were meaningful to the governor and to the first lady, but also the values that were important to Virginians at the time. And so one of those was supporting and prioritizing children and families and their most pressing needs. And it required a trauma-informed lens, and it required an equity lens. And we really felt that we did that tirelessly to ensure that all of our efforts, not just in health, but in education and public safety, in agriculture, because they work on a lot of our food security policy efforts, really that all these child and family agencies made the biggest difference for vulnerable Virginians. And I'll just wrap up by also saying that the campaign slogan was the way forward. So ironically, we're looking to the way forward in this transition. And so as I think about that, and as it pertains to child and family well-being, I would say the one thing I hope they reinstate is our children's cabinet, which was started by the McAuliffe administration. And then we put a spin on it that really prioritized the things that were important to us. So I really think that a similar sort of collective action conversation that carries on with that, what I would call a tradition now, will really allow our stakeholders, public and private sectors, to engage with the executive branch and ensure that they're a part of change in the coming months and years.
Definitely. Thanks for sharing. And I think it's really cool that we have two people on this panel that are both focusing for governors on trauma-informed care. I feel like that's a very unique thing, and something that I'm really excited that both of you, your states, have participated in our cohort, and that you guys get to both be on here to talk about. Really, the goal of this is to talk about the importance of promoting children and family well-being, and governors are actively involved and engaging in that. And so thank you for sharing that. Alana, I want to now finally go over to you and see what some of the next steps are for Governor Carney.
Yeah, so similarly to what I've heard a lot of my colleagues and counterparts from other states say, it's really around enhancing this collaborative approach to address a lot of challenges that COVID-19 unearthed, right? We did some of the groundwork prior to COVID, but really it shed light on a lot of challenges and inequities that exist in our system. And so really thinking strategically about data and data sharing. One of the things that COVID really accelerated was the need for agencies to be able to collaborate better with data and resources in order to solve complex issues. So we have some initiatives centered around that. Additionally, from the project that was created through this program, we piloted it in one school district, our most rural, our largest, one of our most diverse school districts in the state. We want to expand that pilot statewide so that all students can access the resources and tools through their learning management system across the state. We're continuing to invest in our commitment to trauma and trauma-informed care, and really towards a frame of social determinants. We know that students and families across our state have some basic needs that need to be met in order to be successful long-term, and in order to create a better Delaware long-term. And so we have to focus our collaborative approaches, working with labor, working with housing, working with health and social services to solve some of these complex issues. And so we've made some investments in workforce, we've made some investments in technology, broadband, and other initiatives to ensure that we're leaving Delaware in a better place as we transition from this administration. And really, we've built an infrastructure that anyone else can build upon moving forward.
Great, thank you. I am really glad that we have some time at the end. First, just want to thank all of our panelists. I know that I did not give you an easy task of answering all those questions in such a short time frame, but all of you did so wonderful. And now I'm going to open it up to, you're not unmiking or anything for our participants, but please drop questions in the chat if you would like to ask any of our panelists questions. I did receive a question, and whoever wants to, on the panel, wants to speak about it, just go ahead and unmute yourself. It was asking if any state received COVID promoting safe and stable families funds and how their state used those funds. Did any of your states use COVID promoting safe and stable families funds? Okay, so it sounds like we have not. Is there any other questions in the chat that anyone would like to ask? Well, I do have a question. I know someone just asked something about COVID and like what some of those COVID funds are. And as all of you know, it's been crazy throughout the past year and a half to reprioritize how we serve families. But I think more in particular, and what all of the states in this cohort have really focused on is what kind of opportunities have come out of COVID of how to strengthen child and family well-being. And there's been a lot of silver linings, I guess we could say, in that, of opportunities to reevaluate how things are going. And Alana, I want to ask you that question, I guess, since you guys have really reprioritized how you're thinking about child abuse prevention and mental health services and connecting people to that. Do you mind addressing that question?
Yeah, of course. I think the main piece is when we think about these things with an equity lens, it's about access, right? That we learned as our cohort went through this experience that there are a ton of great resources and organizations across our state, both public and private, doing really amazing work. But if you talk to, the mother dropping his or her child off at school, they don't always know what those resources are, how they get to them, how do they access them. They don't know which number to call when their child's in crisis. And so what we thought was the best use of our time, given the impact of COVID, given the disconnect between families and schools and providers, in light of just not being able to show up and ask questions in the same way, that it was important that we made all of the resources that exist and we know that work well to support families available to families where they are going. And we spent a lot of time kind of debating, is this a partnership with libraries? Is this a partnership with local community organizations? And I think all those things are still on the table, but the simplest solution that we could come up with was, in Delaware, we use a statewide learning management system so all of our students in school districts opt into and utilize Schoology. They all use the same platform and parents have access to it. So if we can integrate an application into that platform that brings together all of the resources for students and families, that parents and kids can just in one click be able to access those resources, then we would have made a really big impact in terms of making sure that the tools are there for equitable access for everybody across our state. So that was kind of one of the approaches that we used when kind of thinking about access to tools and resources.
Awesome. Thanks for highlighting that. Thank you again to everyone on our panel for joining us today and for making yourself available and your time out of your busy schedules. We really appreciate it. I'm now going to turn it back over to my colleague, Jordan Hines.
All right, so thank you all so much to our presenting states, our panelists, our participants, everyone joining us here today. This has been a fantastic Governor's Summit. We will follow up after the summit with any specific answers to questions that were asked. I know I saw something about effective community-based programs that can reduce placements in foster care. Really happy to also collect some resources for you all on that. And we are also happy to report that a recording will be available on the NGA website. And we are so happy to have the opportunity to spotlight the great work happening in states. We look forward to continuing to support our members, governors, and you all in advancing priorities on child and family well-being. Thank you so much for being here with us today. We appreciate it.